Dr. Georges Benjamin, the Executive Director of APHA, is here now. We're talking about the theme of this year's meeting, and that is creating the healthiest nation. That is, of course, such a lofty goal, but there's a real commitment to this idea of ensuring the right to health. Talk to me about that.
Well, you know, since this association was founded in 1872, we've believed that health is a fundamental human right. Tragically, a lot of people don't understand that, of course, until they get sick. So, you know, we wanted to really make a big point about that. We know that as a nation, despite the incredible technology we have for health care, we're not the healthiest nation. And we're all working to do that. Let me tell you, I'm down 45 pounds. I'm trying to contribute my part to that effort. But it's something, it's an achievable goal. We just have to dig in our heels and do it.
So can you tell me what's new at this year's meeting?
Well, you know, one of the most exciting parts of this meeting is that we recognize that there's so many people that can't be here. So we're doing something we call APHA Live. So the first time we're going to actually broadcast very critical parts of the meeting, the opening session, our Monday afternoon session with the CDC directors, and some of our special sessions. And these are very important sessions that we're going to have. And so people all over the world really will be able to watch them for the first time.
Oh, that's spectacular. So one of the big public health threats this year that really scared, I think, a lot of people was the Zika virus and it spreading in this country. And as we watched, it seemed a bit frustrating that Congress was delaying funding efforts to fight the Zika virus. How can that change?
You know, the challenge is for the first time the Congress did not step up to the plate in a timely manner and give the public health community the resources it needed to fight what is really a serious public health emergency. And I think we just got to do a much better job of creating the challenges that we have and really pushing them to do the right thing in a timely way.
Talk about Public Health 3.0. What does that mean?
Well, Public Health 3.0 is an important part of us really trying to convince the world that we need to have a comprehensive public health system. So it has several parts. Number one, the public health folks being the chief health strategists for their communities. So I now identify myself as a chief health strategist for health for the American Public Health Association. Number two, making sure we're accountable. So doing accreditation. You know, we have 80% of our nation covered now by health departments that are accredited by the Public Health Accreditation Board. Number three, of course, is actually funding public health to build a real good public health system, and one that is data-driven and has the resources for us to make the kind of decisions that we make that are science-based on each and every decision we do.
And in that way, you're really revolutionizing public health.
It is. It's stuff we've known that we need to do, but for the very first time, the leadership of the Department of Health and Human Services said there's a federal role for us to say that this needs to happen. And I've been working with several of the leaders in the Department of Health and Human Services and look forward to working with folks in the next administration to continue that work.
Dr. Benjamin, thank you so much.
Thank you.